I'm Matt Boulay, this is Melanie Kilcullen. Welcome to BodyMind, the show that connects physical activity with mind stimulation to improve vitality, performance, and overall well-being. Today, we're going to do exercises to target the lower back and to bring it back to health. The first exercise is called an Aldoa, and it's an exercise to actually stretch the junction between two vertebrae to involve one disc. In this case, it's the disc between L5 and S1. We're going to have Melanie lie on her back. And both of her feet are going to be going up on the chair. The idea is to put the feet on the chair, trying to lengthen the legs, but only to your comfort level. That's the first step. The second step is we're going to have Melanie bring her hands over her head. So she's stretching out the upper part of the body. She's going to extend the wrists. And we're going to start the exercise by having her bring her feet towards her. And the second part of the exercise is that she's going to be trying to push the wrists towards the wall behind her. So between the two, what we're getting is a stretching effect between the fifth lumbar vertebra and the first one in the sacrum, creating a little bit of distance for that disc to hydrate. This can be done for 30 seconds and always with taking care of breathing properly. The second exercise is done in a seated position. And in this case, we're actually targeting the space between the fourth vertebra in your lower back and the fifth one. In this case, I'm going to have Melanie sit comfortably. She's going to be bringing both knees out, so ideally we want 90 degrees in the hip and 90 degrees in the knee. The feet are going to be coming out. Once we've got that position, we're going to look at her upper body. We want her back to be straight, and she's going to bring her hands up towards the ceiling. And again, she wants to extend the wrists, looking straight ahead, keeping the chest up. And here, she's going to be bringing the feet outwards and pushing the hands towards the ceiling. This specific exercise targets the disc between the fourth and the fifth lumbar vertebrae. The idea is to breathe comfortably, to look straight ahead, and this can be done for 30 seconds. The third exercise is a stretch. It's a stretch for a muscle that's often very tight with people that have chronic low back pain. The name of the muscle is the hamstring. The stretch is done in a seated position. In this case, we're going to stretch the right one. So the right leg is brought forward, the left knee is bent outwards. This is an overall stretch for the whole body with an emphasis on the hamstring. It's called a myofascial stretch. To get the myofascia involved, we're going to have Melanie bring the hands in front of her. She's going to bring the wrists back, keeping the chest up, and bringing a foot towards her. This has to be done slowly to make sure that it's safe. In that position, Melanie's going to breathe in and out, trying to put emphasis on actually stretching the hamstring. And again, this can be done for 30 seconds. The fourth exercise is a stretch for another muscle that chronically becomes tight with low back pain, and that muscle is called the piriformis. To do so, we'll have Melanie lie on her back. We're going to stretch the right side, so Melanie is going to bend her right leg and bring it on the top of her left knee. In this position, we're going to have her bring both legs up towards her. She's going to use both hands and hold on to the back of the left leg. This exercise actually stretches the muscle on the right side of her pelvis, and she's going to bring the left knee towards her very gently, and as she feels the stretch on the right hip, she's going to keep that position for 30 seconds. Obviously, this would be done on both sides, and again for 30 seconds on each side. By performing these exercises on a regular basis, you will most definitely improve the health of your low back. Thanks for watching. I'm Matt Boulay, and remember, nurture your body and stimulate your mind.